Hi, I'm Marilyn. This is my Seminar 2 professional speaking presentation on my career of choice, which is a clinical research coordinator. The audience to whom this information will be presented will be to those working in clinical research or those interested in becoming a clinical research professional. The following will be an overview of what a clinical research coordinator or a CRC does along with the education needed or other requirements needed for the job. Also, an overview of clinical trials will be given. Before we begin to understand what a clinical research coordinator is or does, it is important to understand what a clinical trial is. A clinical trial is one type of clinical research that follows a predefined plan or protocol. There are 4 phases of clinical trials. These phases are as follows. Phase 1. During this phase, researchers will test a new drug or a treatment in a small group of people for the first time to evaluate safety, determine a safe dosage range, and identify side effects. Phase 2. During this phase, the drug or treatment is given to a large group of people to see if it is effective and to further evaluate its safety. Phase 3. During this phase, the drug or treatment is given to a large group of people to confirm its effectiveness, monitor side effects, compare it to commonly used treatments, and collect information that will allow the drug or treatment to be used safely. Phase 4, this is the last phase of clinical trials. During this phase, studies are done after the drug or treatment has been marketed to gather information on the drug's effects in various populations and any side effects associated with long-term use. This information found in the U.S. National Library of Medicine. In a clinical setting, research is performed on subjects. As noted, research in a clinical setting is performed to help determine and or further determine the safety and efficacy of either a potential new drug, a drug that has been marketed, or a device. If it is a drug that is being trialed, a research protocol is sponsored by a pharmaceutical group or a cooperative group. A pharmaceutical group will sponsor a clinical trial if they have a vested interest in getting a new drug on the market, or if a drug that is already on market needs further review. So say if a drug has already been marketed in a phase 4 study, the pharmaceutical group could come in and sponsor a clinical research study so that they can further prove the safety and efficacy of their drug. A cooperative group is normally one that is tied to a university or the NCI or which is the National Cancer Institute. A clinical research coordinator is one who helps implement the requirements of the study protocol. The CRC will work with and under a principal investigator. A principal investigator, or PI, is a physician who takes the lead or oversees the clinical research being performed. The protocol is a set of rules and regulations in a sense. The protocol will be clear on what is being studied, why, and to whom. It will be clear as to who may or may not participate on the trial. It will also be clear on what tests the subject will need while on study. An example of a test is any blood or lab work, echocardiograms, scans, etc. If tests are required, there will be specific time points in which the tests need to be performed. The CRC will see to it that the tests are done according to the protocol. Anything that occurs outside of the time points is considered a violation, and the study group could then remove a subject from the trial. As a result, the tests and data prior to the removal may be lost. More importantly, before the subject is allowed to participate in a research trial, the CRC will meet with the subject and consent them. By this, the CRC will review what will take place in terms of risks and what will occur during the course of the trial. It is important to note that participation is voluntary and may be stopped at any time. Once consent is signed, the subject will be entered on the study. The CRC will then follow the subject throughout the trial to make sure tests are performed, the trial is being followed as per the guidelines of the protocol, and to report any side effects the subject might experience while on trial. The educational requirements of the CRC are generally a bachelor's degree. Some places will require or will prefer a master's level, which is important to note. So while it is preferred, they will allow a bachelor's level, and to be a CRC, you generally have to have at least that degree of education. There's also a preference of CRCs having professional certifications. By this, there are 2 certification groups. After working for 2 years in research, an individual may apply to sit for the certification with either of the groups. Passing the certification exam and then becoming a certified professional is preferred and often required, as it shows knowledge of the profession as well as knowledge of good clinical practice. I hope that this information has been informative and leads everyone to want to seek this profession. Working in clinical research is as rewarding as it is challenging, and there is something to be said going to the reward of this. Seeing a subject improve while using a drug that is maybe not yet on market, but going to be marketed. Thank you for listening and watching my video. Thank you.